We're joined now by former NHS Trust Chair Roy Lilly to talk about the NHS. A very good morning to you, Roy.
Good morning, Julia.
Thank you for joining us. Now, you sound very chirpy and full of joys of spring. This beautiful,
It's a nice
beautiful
sunny day.
love. Doesn't it make everyone feel better? But apparently not that much better with the NHS, according to this latest survey. This is a regular survey. It's been carried out every year since 1983 by the Nuffield Trust and the King's Fund, both NHS, well, health think tanks. And they basically say that public satisfaction with the NHS has fallen to a historic low. Just 1 in 5 people are now happy with how it's worked. It's just from just under 1 in 4 a couple of years ago. Mainly dissatisfied with A&E, getting access to a GP and dentistry. So pretty much the services most of us use. Are you surprised in any way by this fall in satisfaction?
No, not at all. And if you look at the dates, you look at when the study was undertaken, it was during the very worst time over the winter months. And he was around the block, and we've kind of it's I mean, it's a terrible thing to say, but it's almost not news, is it? That's the trouble. It's become the norm. It'd
be a bit worrying if people were satisfied. Yep, absolutely fine. This is okay.
Yeah, I agree. I mean, the trajectory started to improve. The waiting list, the numbers on the waiting list have come down. The long waits, the NHS have made big impact in that, and the 2-year waits and what have you now have come down to almost nothing. So it had made progress. The problem we've got now is Wes Streeting has decided he's going to dump NHS England. Now, whatever the rights and wrongs of that, and there is duplication, maybe mainly the duplication is in the Department of Health in his stuff, not in the NHS England, but he wants to get rid of NHS England. He wants to run the thing himself. Okay, fine. He's the Secretary of State. He's the politician. He can do that.
He's going to be held accountable. He may as well be the person making the decisions, is my view.
Well, but it's more than that.
You can't be any worse than Amanda Pritchard.
What we've got now is a situation where we don't know what's going to happen. Already people are bailing out. And if you look at the studies of these things in organisational dynamics, the Porter studies, for example, of mergers, 18% of top people just leave. And we're starting to see people leaving now because they're saying, well, I'm not going to wait here and get the sack. I'm going to go and get another job. So we're starting to lose people. People look over their shoulder instead of looking at what they're doing. And we're going to go through a really difficult time because unpicking the Health and Social Care Act, which is the Lansley reforms, which Streeting is trying to get rid of, the legislation itself is 360 pages long.
It kind of tells you why, here's the thing. The people who are going, I'm just going to look for another job, or I'm probably going to lose my job, and they're not doing their current job properly right now, are exactly the people I want shot of because they don't care. Because at the end of the day, if you do a job, whether you're pushing paper in the NHS or you're pushing a trolley in the NHS, or, you get your hands in a patient's, chest cavity, you're saving lives. Your job should be about making people better, saving lives. And if you're only caring about getting another 6-figure salary, I don't want you anywhere near the NHS, frankly.
Well, look, yes, I mean,
sod off, I'd say to them.
And it's easy to agree with that, but somebody's got to run the thing.
No, and I'm happy for that. But if they genuinely just don't care, if they don't think anything, £2 billion being spent on NHS England and the duplication, at the end of the day, they're not accountable to us. I want the person running the NHS to be accountable to me as a voter. I think that's what most people feel. Always the government, So I've got no problem. Whatever the reforms are, we don't want to be spending time working on reforms which aren't going to make people's lives better. I don't see why, even while there are reforms, why people still can't do their day job well. That's kind of where I'm coming from.
I mean, all of the evidence is that when you get big upheavals like this, it's very distracting. You can't plan. You can't have a forward plan. Streeting's now fiddling about with something called a 10-year plan. Well, planning for 10 years against the background of the economy and the world and all the rest of it is nonsense.
But that's the same for every company and every... They didn't even have a workforce plan, for goodness sake, the NHS, for years.
It does have a workforce plan.
They didn't have... Now, I mean, well done, thanks everyone for bothering. But, at the end of the day, people pay a lot in tax, and they feel they're not getting the public services they need, and particularly the NHS that they rely on. There's still massive long waiting lists for a lot of people for a lot of things. People don't go to A&E. I mean, that's the thing. If everyone went to A&E who thought they probably should go to A&E, the waiting list would be even longer. But people forget, I'm not going to get seen. There's no point. People go to GPs when they could eventually get an appointment. We're actually seeing a lot of people who are dying or could have been cured from cancer because they've not gone and sought healthcare. And it's actually a worse problem for patients and a bigger cost to the NHS because of all these problems. problems. If we put you in charge tomorrow, what would you do that would be a game changer that could actually, because we do need a game changer. Is it, as a lot of people now suspect, partly the problem is the monolithic system?
No, I mean, what I do, the first thing I do is to sort social services out.
Yeah, number one, yeah. Because
if you look at where the big demand comes from through A&E and through beds being blocked up, it's the over 65s and the under 9s. The under 9s, of course, come into the purview of the health visitors and the schools and all the rest of it. So if those two areas, those two groups of people, if you sort that out, you free up a huge amount of headroom in the system. But Streeting won't do social care. He's got a 3-year study going on.
No one needs another review, another study. And you need to have social care costs and running it coming under the. I mean, he's officially Health and Social Care Secretary, isn't he? And you need to take it out of local government, make it a responsibility and a financial responsibility of the NHS, because then there would be an incentive to keep people in their homes, not getting ill, not needing A&E, and to get them back into their homes when they've been in hospital.
Exactly. And the issue is, I mean, there's a lot of focus on getting people home, and there's a lot of focus on capacity.
Yeah.
That leads us to something called what managers call the capacity paradox. The more you increase the capacity, the more it fills. Yeah. The way to deal with this is to stop people coming in the first place.
Yeah.
And if you look at social care, local authorities have raised the eligibility criteria for help for elderly, frail people, particularly to the point now where there are, ready for this, 900,000 elderly, frail people who used to get social care who no longer get it. Is it any wonder a big chunk of them end up in A&E?
Very good point. Roy Lilly, I'd put you in charge tomorrow, I really would. Former NHS Trust Chair, thank you so much. He knows his potatoes on this, Claire. What do you reckon?
He does. I think he's spot on. There's the problems in social care that are really, if you need to sort those out.
Boris Johnson had a ready-made plan. July 2020.
Oven ready to go.
2019, never happened. Everyone knows.
Hospitals and all the rest of it.
Let's have another review. and then you're not going to deal with it.
3 years later, you're not going to deal with it because there'll be an election coming up.
I know the answer before people shout at this. People go, "Oh, people should look after their own elderly." Yeah, if you live 200 miles away and you've got a full-time job and young kids, you probably don't have time to do 24-hour care for your 80-year-old,
or if you live in a
great grandmother.
Flat, you're not going to move your grandmother
Funny
in.
Exactly. The world has not moved on.